The material latex is mostly encountered in one of two places as far as the shoe world is concerned. You find it in shoe soles, like this one here. You also get this hollow structure that is comparable to a TPR sole, although there is no overhang, there's a lot more material on the sides, it's not as thin, and it's actually an expanded material in this case. Latex is mostly encountered as latex foam. Skin on the outside, bit foamy on the inside, and very easy to recognize because it says latex or contains latex. The reason for that is because this is a material that can cause allergies. Quite a few people are allergic to latex, natural latex, and this is why it has to be mentioned on the outside. Of course, if the abrasion has already taken care of this, then you don't see it anymore, and you need to work based on your identification. Now, as I said, identification, it has these hollow things on the inside here. It's yeah, sometimes it's foamy, but in this case it is actually compact. It's still a little flexible. The foam variant, you mostly find that in metatarsal pads on the inside of the shoe. The foam variant is not very stable in the shoe. You find the non-expanded variant. Even if you confuse it with TPR, not a problem at all with thermoplastic rubber because you treat it in the same way. The soling variant, cut it or grind it. Make sure it's clean, as with any material. Apply the Renia primer, wait about between 15 and 30 minutes, 15 minutes minimum, 30 minutes maximum, and then apply any adhesive that is suitable to be used with our Renia, and I would go with our multi-col, Col de Cologne or Syndic Total in this case. Very easy, same as TPR. So even if it is actually a TPR sole and you think it's a latex sole, no harm done because the process is exactly the same. The material you encounter in orthopedic insoles inside the shoes, mostly in the form of metatarsal pads, little pads that you can slide in or attach to a pre-made insole or to a vacuum formed insole. This material is very soft, a very soft foam and not a very stable foam. This can actually be bonded with any Renia adhesive, it doesn't matter. Usually it's attached to EVA, to Poron, to Plastisol, so anything that works on these materials will work on your latex foam as well, for the very simple reason that the latex foam is much less stable, much less sturdy than what you bond it to and what you bond it with. So that's the downside. There's almost no way to take that med pad out of there without actually ripping it apart and destroying it. So this type, very easy to bond, just basically follow the instructions for the other side, use any Renia adhesive that works on that, on your EVA, on your polyurethane, and you'll find it will work on the latex as well.